I'd like to welcome you to Facebook Live tonight. We're going to go about 25 minutes, maybe a little longer. We'll see how the questions are going. So I'd like to welcome everybody. I've been off for a few weeks, but it's great to be back on. So if you've got questions, you feel free to type them in. Hopefully I'll get to see them. And I want to start off with a couple of announcements. First of all, I'm going to be teaching a 2-hour class on April 30th. It's a Saturday, and it will be from 10 a.m. to 12 noon Mountain Time. It's one of my classes that people love because it's going to be on, well, a lot of different ways to improve your vision through color therapy, aromatherapy. We're going to do some eye exercises, and I'm going to teach you how to negotiate a healthy prescription of contact lenses or glasses with your eye doctor. That's always a challenge, especially if you want to improve your vision. There are ways that you can talk to your doctor so that you can get what you need. I'm going to take a couple of questions that people have emailed me, and then if we get any questions from the audience, I'm happy to answer those as well. So the first question that I'm getting tonight is one that I get a lot. It's on monovision, and what do I think of monovision? This is with contact lenses, and what are the alternatives if I don't like monovision? So for those of you who don't know what monovision is, this is a prescription where the doctor is correcting one eye for distance and one eye for near. If you look at my hands right now, this is kind of the setup. So my right eye is the distance eye, my left eye is the near eye. You can see that there is a change in the focal distance between your eyes. This actually sets up a couple of scenarios. One scenario is double vision because your focal lengths are different between your two eyes. Let's say your right eye is corrected for distance and your left eye is corrected for near. What this means is that when you're driving, your left eye, because it's corrected for near, is not engaging with the right eye. So a lot of times the brain shuts off the eye that you're not using, and this is very disturbing because you're now eliminating, or at the very least reducing, the uh, integration between your two eyes. So the brain suppresses or shuts off the left eye because it's the right eye that's the driving eye. And at the same token, if you're using the computer or reading, it's your left eye that's carrying the load, and the right eye is focused somewhere out at 20 feet, but it can't come into a near focus. So again, the brain is suppressing the right eye. So it reduces, or in fact even eliminates, the potential of binocular vision. This is disturbing because over time, each eye is carrying more of the load than it should be, and this can lead to eye strain, eye fatigue, and eventually it can change the structure, the anatomy, the tissue of the eye in a way where it can actually even lead to a disease process, maybe things like glaucoma, cataracts, macular degeneration. So based on this description, it's obvious that we're not meant to correct our eyes in different focal distances, even though the doctor may think it's convenient. It really sets up a situation where you're going to be experiencing a lot of visual stress. So it's always better to correct both eyes for distance. And if you're nearsighted, one of the techniques that you can do is actually ask your doctor to undercorrect you slightly when you read the distance eye chart. So instead of seeing 2015, you could see 2020 or even 2025. But the advantage of that is that um, your eyes are going to be um, matching in the distance, and because you're undercorrecting, you'll be able to read. And I have so many patients in their 50s and 60s, 70s who are nearsighted. By undercorrecting them a little bit in the distance, they're able to keep their near vision. The scenario is when the eye doctor wants to overcorrect you for distance, and you'll feel it in your eyes, and you can tell him or her, whoa, this is too strong for me. Then you can get a slightly reduced prescription in the contacts, and you'll still be able to read without reading glasses. Now, in the farsighted side of things, it's a little trickier. But again, if you do my eye exercises, you can regain your distance vision as a farsighted person, and the magnification power that you need up close could be minimal. This is where, again, you could use things like pinhole glasses or do my exercise, the minus lens to blur. That's the opposite lens prescription that a farsighted person would use. You can also do my convergence and divergence exercises to build more flexibility and versatility in the eye muscles. And this would be a way for you to continue to hold on to your vision based on, not wearing such a strong prescription. But the bottom line in monovision is you don't want to do it. You definitely don't want to do it with a surgical intervention like LASIK surgery or cataract surgery. That's going to be a disaster. I know that's not a popular thing in the room, that some people love monovision and they love LASIK surgery, and more power to you. I did a post recently on TikTok. By the way, I would get on my TikTok feed because I do a lot of great 20-second videos on TikTok. I did this one on LASIK surgery and got about 350,000 views. Most of them were against what I was saying, which is that they think that LASIK surgery is a great surgical procedure. And for some people it is. I was just putting a different perspective on it. And so it created a lot of controversy, a lot of talk back and forth, which I love. So, anyways, that's the situation on monovision. All right, I want to take a question from Zizo. He's asking about, or she is asking about dry eyes. So, dry eyes actually start in the eyelids. I was giving a session today to somebody. Actually, it was my class. That's what it was, my intensive. And somebody was really surprised when I said dry eyes actually start in the eyelids. When the eyelids become irritated, when there's inflammation, this is what creates a dryness in your eyes, because it's the eyelids that house the tears that produce, the glands that produce the tears. And so it starts with getting rid of inflammation in the eyelids. Now, how do you do that? Well, it's a combination of using natural eye drops during the day, blue blocking glasses if you're using screens, because blue light is going to dry out the eyelids even more, dry out the eyes. And then the evening, one of the techniques I like to use is a castor oil eye massage. You just take a little bit of organic castor oil and you massage it into the eyelids in the evening, and you do the homeopathic eye drops and or the MSM eye drops during the day. Make sure to increase your fats and oils in your diet, reduce your visual stress, get natural sunlight. These are some of the techniques that I recommend in terms of healing the eyelids and hydrating the eyes with natural eye drops during the day. Let's take a question from Gabriella. I was told by a doctor LASIK is done only on one eye for older people. cannot be done for both eyes. Well, I don't know what your prescription is, but you definitely want to, Gabriella, you want to match both eyes for distance if you're going to do LASIK surgery. Now, maybe in your case, one eye is a lot more nearsighted than the other eye. So by getting the LASIK surgery in one eye, it will match the distance prescription so that your two eyes are tracking together. But the bottom line is that if you're going to get LASIK surgery, you want to have both eyes matching in the distance so you're seeing as similarly as you can. That's really the bottom line. Now, with LASIK surgery, you may be more susceptible to dry eyes. You may be more susceptible to floaters. You also may have a situation where the LASIK surgery works for a while, but then your prescription starts coming back. And the reason why that happens is we want to blame the prescription just on the eyeball, but it's not the eyeball that's necessarily causing the prescription. It's what our programming is mentally that causes the eyeball to change its shape that creates the prescription. Now, I know that's an advanced idea that we would think, what I think is going to affect my eye prescription? But precisely, any prescription you wear is only a reinforcement of the programming on what you're doing to your eyes. And if you're nearsighted, what you're doing is you're tensing your muscles up and you're pulling the world in as a way to adapt to whatever the environmental stress is. And so when you do the LASIK surgery, you're only changing the eyeball, you're not changing the programming, which is actually much stronger than the LASIK surgery in terms of influencing the prescription. So it'll work for a while, but then it won't. So I would be very careful about LASIK surgery. If you're going to do it, I would recommend doing my eye exercises afterwards. All right, let's take a question from Linda. Is it okay to take both resveratrol and grapeseed extract? Well, both of those are really awesome supports for eye health, and the answer to that is yes. You can start with a low dose to begin with and see how your eyes and body respond. But both resveratrol and grapeseed extract are super great for eye health, eye circulation, and I don't see why not. You could take both of them. Let's go to Bob. I have an eye distortion in one eye. The other eye seems really good, but the bad eye sees faces slightly stretched on the TV screen. It makes me completely mad. Nothing is sharp, as is in focus as it should be. Yes, I do wear glasses. I was diagnosed with macular pucker a year and a half ago and had surgery to fix it. Whenever I go to the theater, it isn't the same watching movies. It's like covering the bad eye. Everything looks sharp and great. Okay, so I get the idea, Bob. So first off, you might want to take a look at my videos on macular pucker. Basically, the macula is the center part of the retina where we see detail, and the vitreous, which is the gel sac that sits in front of the retina, begins to pull away from the macula area, which creates a wrinkling in the macula. Now, when you get surgery, you're apt to be getting scar tissue. So here is a prescription for you. I can't guarantee it, but certainly this is something that I would suggest. You want to really load up on your carotenoids, meaning lutein, 16 milligrams a day, zeaxanthin, 6 milligrams a day, astaxanthin, 12 milligrams a day. These are essential ingredients for the macula. I would consider a saffron supplement, a curcumin supplement. These also help in the microcapillary circulation of the retina. Saffron really helps feed the macula. I would also consider a type of vitamin E called annatto, Annatto. Now, Bob, keep track of my content because I'm going to be releasing these 3 supplements. I've been testing them for over 5 years with my patients, and they really help the retina, the macula, and eye circulation. So I would add those 3 when they come on my web store. Make sure you're wearing blue blocking glasses. I would consider an digestive enzyme called serrapeptase. Serrapeptase has been shown to help remove scar tissue in the eye. I would use my 15% MSM eye drops 4 to 6 times a day. I would also consider doing a castor oil massage in the evening on the eyelids. These things are going to help heal the vitreous, which could reduce the pulling on the macula. And then finally, I would do my eye exercises, Bob. One is called the animal eye chart. The other is the yin-yang peripheral vision exercise. You need to do some physical eye exercises to increase your peripheral vision between your 2 eyes, which will stop distracting you on the difference your 2 maculas are showing you. So you've got to do a combination of eye exercises with all of these nutrients. And if it still is not happening, contact me at appointments@drsamberne.com, and we could do a telemedicine session, and I could maybe give you some more pointers. But there are things that you can do from a macular pucker standpoint, and I know it's a bummer, but these are some of the things that you can do to reverse some of the symptoms you're having. Can I use coconut or olive oil instead of castor oil? Well, you can, but castor oil has a specific function that it really is a wound healer, reduces inflammation, and it absorbs really well into the eyes. So if you don't want to use castor oil, another approach would be to use eye bright tea. You can brew it up, let it cool, put it in a mason jar in the refrigerator, dip a washcloth in the eye bright tea, and place it over your eyelids with your eyes closed. If you don't want to do eye bright, you could do chamomile tea. That would be another one that you could actually put the tea bags over the eyes. But doing some kind of a compress on the eyelids is really helpful for reducing some of the inflammation. So you can use herbs if you don't want to use castor oil, but you need something. You need something. So anyways, I hope that that's helpful. Thanks for the question. Carol is asking if I've had laser surgery on a tear in a retinal wall. Is it okay to take serrapeptase? Yes, it is. Will it affect the surgery seal? No, it won't. I would also add the 5% MSM eye drops. I would also hydrate your retina quite a bit. And again, the same protocol where you're using lutein, zeaxanthin, astaxanthin, curcumin, saffron, and vitamin E, the annatto vitamin E, these are all really great for improving the retinal structure. And I also would consider doing my N palm hum exercise. This is a relaxation exercise. I would make sure you're wearing blue blocking glasses for all your screen time. Because you see, when you're exposing yourself to blue light, it's drying the eyes out. It's like going to a tanning salon, and it's really drying things out in a way where your retina needs hydration. It needs nutrients and hydration. And in adding all of these things, you can start to heal the integrity of the retinal wall, the retinal cells, and that would be the protocol I would suggest. All right, let's go to Margaret. She's got a sty. So with a sty, I would definitely consider doing some natural eye drops like Optique or Similacin, along with the 5% MSM. I would do some kind of a evening compress, maybe with eye bright tea. You could also drink the tea. You need to massage the eyelids, maybe with castor oil. Now, with the sty, it can be very contagious. Whenever you're touching your hands on your eyelids, make sure you're washing your hands completely so you're not giving yourself a bacterial infection. Drinking the eye bright tea along with using it as a compress and doing those hydrating eye drops during the day. Eventually, the sty will move off, maybe in 5 to 7 days. Again, boosting your eye nutrients, using blue blockers, taking a rest from all of your screen time. Now, another thing to consider with the sty is your digestive health. Are you getting enough probiotic support, microbiome support? Is there any stomach issue? What is your digestion like? Because the eyelids mirror on an acupuncture level our stomach, our spleen, our gallbladder, our liver. Sometimes actually going to get some acupuncture. Now you won't get the needles around the eyes, but even doing it away from the eyes. Remember, the meridians run from the bottom of the feet to the top of the head. Getting some acupuncture can move out lid congestion. I've seen this quite a bit. So there's a lot of natural things you can do to reduce the sty. Support it by hydrating your eyes, using natural remedies on the eyelids to make sure there's good circulation and good tear production, and stay the course. Okay, Sandy, I'm not sure, Procara, ridges on your eyes. Is it affecting your eyesight or your vision? Is there any, is there deterioration in how you're seeing? What's your inflammation like in the eyes? What's your eye pressure like? I would need more information before I can make a comment. But here's the situation. If you're not having any symptoms, if you're seeing things really well, then you do the proactive things like hydrating your eyes during the day, making sure you're getting enough eye nutrients. And I am all in on using using food as medicine to heal your eyes. Again, mostly plant-based, rainbow diet, antioxidants, supporting your microbiome on a gut level. These are things that are super important. Thyroid health, adrenal health, making sure you're getting enough fats and oils, blue blocker protection. I mean, these are things, by being proactive, you are reducing the risk of eventually developing something that will explode into an eye disease. And then there's this surprise. Oh my, where did this come from? Well, a lot of times these disease processes have been brewing for quite a while, and it's just that now you're going to the eye doctor and he or she discovers it, or even you're having some symptoms like cloudiness or haziness or eye pain or eye inflammation or high eye pressure. These things usually have been brewing for quite a while. So this is where, if you follow my content and you do the things I suggest and recommend, and this even goes for the type of optical system you look through, glasses, contacts, you want to be careful that you don't go into optical systems like progressive lenses or monovision, or just even an overcorrection in your prescription, because these things over time are going to cause your eyes to go south. All right, so Paula is asking, you're making a comment, you're asking your eye doctor to make glasses without astigmatism correction. What would be something I can say to him as why I want a pair of glasses like this? I plan on saying it, I just want to experiment at home only. Well, sure, and you could say that you want a prescription without astigmatism because you want to try to reverse astigmatism, and you've learned that by wearing a prescription that doesn't have astigmatism, you're reducing the reinforcement on what your astigmatism glasses are doing. And you have to assure your doctor that you're going to only use these in non-demanding and non-threatening situations. And if you do that, you have a chance to get a pair of, glasses without the astigmatism. And, it's going to feel weird when you put it on, because what astigmatism glasses do is it warps your vision. It gives you a warp, a distortion that you get used to. And so when you get a non-astigmatism prescription, you're now looking through a lens that's not warping the world, but because you've been so used to the warp, you're going to go, "Ooh, this is weird," but it's actually the way it's supposed to be. So as you continue to wear the non-astigmatism glasses, perceptually, you're going to start to get used to the unwarping that the astigmatism is causing. Remember, astigmatism is a twist in the eye. It also could be a twist in the body, so getting some body work, craniosacral, Rolfing, something that will unwind your body's twist or asymmetry is a really good thing to do if you're going to embark on the astigmatism journey of reduction. Now, another thing, and this came up today in our class, there is an eye exercise that reduces astigmatism, and this is called the animal eye chart. You can Google it. It's on my website, and download the eye chart, print it out, follow the directions. It's a stretching exercise, just like stretching your eye in a clock. This will help release the muscles so that they start working in a more balanced way. Remember, we've got 6 muscles that attach to the eyeball, and in astigmatism, those eye muscles are not working equally. Some of them are working more than the other, which creates a misshape in the eye. This is what creates astigmatism. So by getting some body work and then not wearing the astigmatism glasses, you release the twist in the body, you release the twist in the eyes. It can happen pretty quickly, and you'll start noticing that you see things very clearly with the non-astigmatism glasses. So good for you. It definitely works, and I appreciate the question. All right, ladies and gentlemen, I'm going to call it a night. It's been a pleasure to be with you, and I will see you next week. Thanks again for your questions. If I didn't answer your question, send it to hello@drsamberne.com, and I'll be very happy to answer your questions. All right, have a great week, everybody. Take care.